it's a privilege for me to operate on other doctors and nurses. I think it's the greatest compliment when it comes to my profession to have somebody who's really medically knowledgeable trust me with their foot. Um, we have Dr. Marty, and I'll just refer to you as Dr. Marty at this point because I think it's probably more apropos. Tell everybody at this point, first of all, you can start with your credentials, and second of all, tell them about your experience from start to finish. And intermittently, I'll interrupt you a bit just to keep us on track. But really, the way this came about was Dr. Marty was sharing with me some insights that he had as a medical professional after undergoing cryodecompression neuroma surgery, and those insights were pretty enlightening. And so, what my hope is that you'll be enlightened by what he's telling us, and also that my hope is that you'll get a little bit of confidence in the procedure based on another medical professional. So, Dr. Marty, tell us what your experience was, and then we're going to bring to the table some of these enlightened facts about your recovery and the procedure itself.
Sure. And thanks for having me on here, Dr. Horwitz. I'm out in California, and so I'm a runner. I'm very active. I am a medical doctor. I'm a pediatrician, and I'm a public health officer out here in my area in California. So again, I'm very active, and I just basically started to feel some pain in my left foot, underneath my left foot. And I figured, well, it's probably just maybe overuse. I went to a local podiatrist and said, what's going on here? He just, overuse. And so we basically were using some foot pads, looking at changing my shoe, looking how I was running, and that didn't do anything. So he basically did ultrasound, and he says, it looks like you may have a Morton's neuroma. And so then I'm thinking, oh, great. What's this going to do for me and my activity? So, I started to research it a little bit, but he initially just suggested we try at least a cortisone shot. And I eventually had 2 cortisone shots. They're to me like Band-Aids, and I didn't want any more. It really, after a while, I still had that pain, and it was really hard. I could walk. I certainly could not run anymore. So I was just really distraught. So I began doing some research, and I basically went online. I mean, I went online, went on YouTube, and I was just saying, what are the treatments for this neuroma? And everywhere it was basically saying, well, you can try these non-surgical, but when it comes to surgical, it said basically you have to cut it out. And so, that I don't like to do any cutting out anything. And I'm thinking, cutting out a nerve, what's that going to do? And it basically, I was looking up the fact that the side effects or the downstream implications was that you could end up with what they call, and this, stump neuroma. So you cut it off and you have a stump there, and basically it can reactivate and you can start getting the pain, and then you get it back, and then it's really hard to deal with. Anyway, long story short, I found Dr. Horwitz and a few other podiatrists around the country. Certainly nothing in California. Nobody that was doing this cryo procedure. So it kind of was really exciting for me to think, well, you could freeze it, and I didn't totally understand all of the procedure, but it seems like you could freeze it and the pain would go away. So I was willing to give it a chance. So I contacted Dr. Horwitz because he had a video on it. You can look at his other video of somebody in his office that actually is undergoing the procedure. So I said, well, this, everything looked really, the area looked great. His operative area looked great. He explained everything really, really well. And so I said, he's the guy that I want to see. So I figured, well, it's
Marty, let me interrupt you 1 second, because I want to expand on what your symptoms were, because we already established that you're active, but I want I want you to just simply expand on what exactly was happening to you, and you can describe it from the point of view of the type of pain, the duration of pain, stuff like that. I just want you to share that.
Yeah, it's an unusual thing because it's I didn't know what was going on, and until on the ultrasound when we saw this like enlarged nerve area it's under it's on the bottom of my foot, of my left foot, in between my third and fourth toe. So that area right there was really painful, and it felt like you were always walking on. Well, sometimes it was worse. Sometimes it was just like walking on a marble. But other times it was pretty sharp pain, and so there was nothing I could do to make it better. And I had traveled. We had actually had traveled to Europe while I had this, and it was horrible. I was, limping around. So it can be sharp pain, it can be dull pain, but it's there pretty much all the time, and sometimes at nighttime it even throbs.
And how fast did this get to the point where it started to really feel out of control?
Um, Probably with it started. It started pretty gently and dull. It was just a dull pain. But then, as I was walking more and trying to run, it just got worse and worse. So I would say over a period of 3 months, 2 to 3 months, it just got to the point where I said, I have to do something. I can't do these Band-Aids anymore. Can't do these shots. I can't. My shoes that I changed 3 times was not working, and it was just this constant, chronic, horrible pain that wouldn't go away. And I'm thinking, oh my goodness, what can I do? So that, again, leading up to what I said, I found Dr. Horwitz.
We fast forward now because most people that are watching this have seen my other videos and know the process. And now I want you to really take us to the point where you had some stuff that you just having gone through the process figured out about the healing process that you wanted to share.
Yeah, well, so the process was done, and I traveled the next day after Dr. Horwitz saw me. I basically was traveling home in an airplane, so I was hobbling around. I asked for a wheelchair because it was I couldn't walk those long ways to the gate and whatnot. So it wasn't horrible, but I asked Dr. Horwitz, it's like, how long will this take to heal? And he said, well, it's going to take some time, and you just have to be patient and whatnot. So basically, I figured the initial surgery, until the area healed, it would be, it would be a week or so before the actual suturing and all of the area, generally just where he did the surgery, would heal. But you know what? After that seemed to heal up, it was still, when I walked on it, I was getting a little disappointed because I said, I'm still feeling something on the bottom of my foot. I'm still feeling it, even though I'm thinking, well, if the nerve has already been frozen, that whole procedure, and then there shouldn't be any more pain there. So I was getting a little bit frustrated, and I kind of kept bothering him and saying, I still feel it. But then I figured, you know what? I'm going to give it more time. I stayed off of it, although I didn't stay in bed or I wasn't hobbling on crutches. I basically gently walked around on it. But it took, I think the bottom line is, for people that have this, is that you have to be patient. It took basically another 3 to 4 weeks, until this feeling like you're walking on maybe, again, something in your shoe, right in that same area that I thought was still the nerve, still the problem. But it basically has to settle down, and you have to be patient. And so 3 to 4 weeks later, it was 100% better. But I was so worried, so when you get it, when you have the procedure and you think this is done, it's frozen, it should be good to go. It's not, and that's normal. At least to me, it was normal that you had to wait that amount of time. But be patient. 3 to 4 weeks later, it got exceptionally less. It It was good. It was not painful. Yeah. So again, you're walking on your foot, so it's going to be sore for quite some time. It's not like something that was taken care of on your arm or your back. You're putting pressure on your foot all the time because you're walking on your foot. So it takes longer to heal. Even the sutures took longer to heal. Because when I put in sutures in somebody's arm or whatever, usually 7 to 10 days, but we had to wait a good 14 days to even take these sutures out because it just takes longer to heal. But you know what? This is what, November, and I had the procedure at the beginning of the summer. Again, I had to wait 3 to 4 weeks, and now there's nothing there. It's like I never had it. It's perfectly fine. There's no soreness. There's nothing. I don't have to baby it. I don't have to worry about special shoes. I don't have to wear pads. I'm fine. So I think the key is patience in this procedure, but I trust it.
I tell my patients because it's been occurring concurrently with your assessment and our phone calls as I followed you. I had other patients, some of which were, as doctors, we often relate, you'll relate to this, high maintenance. You know what I mean? I had a wonderful lady. She had 2 kids, 2 little girls, cute kids, would come in and she was freaking out about her recovery. She's an ex-ballerina and she is very light and she was stressed out. She was a mom. And she was, Dr. Horwitz, are you sure? Are you sure? And I just was able to fall back on my conversations with Dr. Marty and other patients and say, reassuringly, you have nothing to worry about. And, you're always as good as your last patient when it comes to this stuff. I know I pour enthusiasm into it. I love treating people from all over the country with this problem. But when they have problems, you wear them no matter how much experience you have. And she came back to me at about the 2-month mark or 3-month mark. And she goes, you were right. She goes, I am pain-free. And so the moral of the story and why I like to publish this type of follow-up video is because it's so important for people to first be able to trust me that I'm not pulling any punches. This is, surgery is surgery. And even though this surgery can seem magical, the way we present it, it still requires a post-operative period of convalescence. I think if you were on it more, you would have had a longer period of time where you had that sort of, if you'll agree, it's sort of like a rolled up sock feeling in the bottom of your foot. And that's a common pain or sensation that people have after foot surgery, especially forefoot surgery. And this is something that people will say, God, it was irritating. And I just wasn't sure whether it was going to work. The surgery was going to work. The message here is that consistently people will have this problem post-op, which is not a problem. It's just simply recovery. And then they get better. And it should be expected, and that it is part of doing surgery. Conventional neuroma surgery requires cutting the nerve, as you know, and it's not ideal at all. And then also during the process of cutting the nerve, when doctors elect to do this, they invariably remove fat from the bottom of the foot and leave patients oftentimes with a problem that is even more persistent, which is now due to the resection of fat. So not to confuse anybody, but my point is we are so good at decompressing the nerve and leaving the fat in place so that we're not disturbing any of the anatomy that protects the metatarsal heads from the ground forces, that we know that the problems that are occurring post-operatively or the sensation is simply just a post-operative sensation. So 2 takeaways here. One, you mentioned 2 weeks. I usually tell people 3 weeks before their sutures are removed because, again, it's the foot. Lots of people swell up differently. And then, of course, expect this sort of temporary discomfort. But the moral of the story is patients do great with this procedure, but must understand the pre-intra and post-operative considerations. So are you running? Now that's my question of the minute.
Am I running? Well, as you know, I had after all this, and I fixed my left foot.
Oh,
I've been a marathon runner my whole life, and
right.
so I kind of screwed up my right big toe, and so I'm dealing with that, and that'll be fine. But yes, I will be back running. If I could run on one foot, I would be able to run on the left foot. But I don't have any more neuromas, but I'm just dealing with a little issue here. But I definitely can run on it, and I'm excited. I'm excited to begin to start running again. I just wanted to say one thing when you said the rolled up sock. Um, yes, it does, but that was later. It early on. I mean, you really may feel like there is the neuroma is still there. I mean, a dull sensations. It's almost like a marble in there, and you're walking on something, and so don't worry about that. That will just go away. It'll get less and less painful. It'll become very dull, and then it's gone. It's absolutely gone. So that will take, like you said, it could be 1 month, it could be two, it could be 3 months. I think I was fine after just probably 2 months, 2.5 months or so. But I'm sure it varies for everybody.
Well, I'll tell you this. I am a foot surgeon that's done thousands of foot surgeries, but I've never had foot surgery short of an ingrown toenail removal that I won't go into by my pediatrician. But so I can't relate. But the fact that people like you trust us and that allow us to work on you and travel across the country to get the work done, I'm deeply appreciative of that, and I'm deeply appreciative of you and sharing this information with the public. I I think that ultimately I'd love to hear after you finish your next marathon, and maybe at least be able to report to the patients that have seen this video in the comments section. Dr. Marty has accomplished marathon, his latest marathon, et cetera, et cetera. You don't have to tell me how you placed unless you. Anyway, thank you so much, Dr. Marty. I deeply appreciate this, and look forward to talking to you soon.
Thank you so much for everything you've done. And again, everybody out there, give it, if you have that neuroma, this is the way to go. To me, it's the only way to go. Thank you again.